we're on a good track here. We're doing this unloaded strategy. Can we bring back some load? Because this is like the kind of the recent theme here is we've gotten all these red lights. The moment she does something sagittal with load, it's a red light. We just got this green light unloaded. Now, for this last little bit of stiffness, do we actually need some load to kind of help finish that reduction? So I get her doing just the classic retraction extension in sitting. It's immediately a red light. It worsens her immediately. So then I think, okay, let's try that again. And just as a quick test, I put my thumbs at her upper thoracic spine. I said, try that again, because it was painful. Her doing that was painful. I give her that pressure. Oh, there's no pain. It feels a lot easier. It's hard for oneself to get that level of pressure. Like we all know, like you can put the hands here, get that support, go back. But the hands, you're right at the junction, maybe. It's a little lower than that. Mm-hmm. Too low to really get for the hands to have a good, to have a good effect. And also the hands, there's that soft tissue approximation. Like they actually kind of limit you a little bit in the movement. So it didn't seem like the best choice. But at this point, and here, I've got to give credit to other folks because I had just started with a new batch of diploma candidates. Like the day before, 2 new people arrived. Okay, so they're doing the diploma program. And I had to give them an orientation of the clinic. And as I'm giving them the orientation of the clinic, we're going through closets and drawers. And what do I see? I see the old Mackenzie retractor belt. You know what that is? The retractor belt, you're familiar with that?
Yeah.
Okay. I mean, no one's talked about that thing. At least in the last 5 years, I've observed a gazillion courses and taught a gazillion courses. No one's bringing up the retractor belt. So I don't know who is still, familiar with it. But for those who don't know what I'm talking about, it is a belt in the shape of a T, where you have a long, the vertical side of the T, if you will, is quite long. And you placed it so that vertical side is going along your spine underneath your buttocks. And you're sitting down on part of the strap. So your body weight is keeping the strap down. And then the horizontal part of the T is right at sort of the T3, T4 area. So, and you can hold the ends, the tips of the T, you pull them forwards, and then you can keep that as you're doing retraction. And it puts nice counter pressure at that upper thoracic spine. And for some people doing retraction, it gives a nice effect. So in her case, because I'd seen this the day before, I'm like, oh, let's grab the belt. I haven't used the belt. I don't know if I've ever used it in my career. This was like the first time. So I grabbed the belt. She throws it behind her. And I thought of it because of this finger test, right? The fact that it was so much less painful. And we think she just needs this little extra pressure at that upper T-spine. And then this movement, instead of being a red light, it might need a green light. It just needs this very specific local pressure. So she gets the belt in there and she doesn't use it for retraction, but she's doing retraction extension, right? Retraction extension over that belt. And it's pain-free. It's feeling great. And afterwards, finger is significantly better. A nice green light.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.